Welcome to the EPG Pathshala program. My name is Dr. Saman Afroz. I am a faculty with the College of Social Work, Nirmala Niketan. And I've been teaching health since a long time, and I've done my MPhil and PhD in public health. I'm going to talk on the module 4, which is very close to my heart, and it is on advocacy in public health, right to health. It's a part of the course on public health and social work. This module explains and discusses the scope of advocacy in public health by taking the case and example of the campaign on right to health care launched by the Jan Swasthya Abhiyan in 2000. It is because of the efforts of this campaign that the Supreme Court in several cases has extended the right to life mentioned in Article 21 of the Indian Constitution as right to health, which is now considered as a fundamental right in spite of the fact that it was not mentioned in the Constitution of India. Now, to begin with, let us try to understand what advocacy is. Advocacy is a strategy used around the world by NGOs, activists, and even policymakers themselves to create, reform, and influence policies, and also to effectively implement and enforce it. It can also be defined as an orchestration of strategies to ensure that issues become public and affect policy change to promote social justice. So, in simplistic term, I can say that social advocacy involves strategies that aims towards creating, reforming, and influencing policies, and also to effectively implement an existing policy. The essential features of advocacy would include, first and foremost, identifying and framing issues based on authentic information, then mobilizing affected, interested people to build networks and coalitions, and thirdly, to plan strategically for sustained campaigns. Advocacy in public health has been defined by WHO as a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and systems for a particular health goal or program. Now, what are the steps of advocacy in public health? As I mentioned earlier, the first and foremost step is identification of problem, which involves intensive research. Once you do research in the field, only then you would understand what are the public health issues present in a particular area. The second is generating public opinion and mobilizing the affected people. That means informing people or making the people aware that this is their existing problem. Okay, and then mobilizing them, bringing them together and helping them to come together and get involved in this whole advocacy campaign. It also incorporates networking with various NGOs and building alliance with other groups, because if you want to do advocacy in a particular area as a single individual or as a single organization, we would not have enough strength. But if we bring a host of organizations working on a particular issue, it would definitely create more pressure on the government. All right, and as I mentioned here, that generating public opinion and mobilizing affected people is important, and media can play a very important role in this. So media is an important instrument for generating public opinion. Then the last and the most important step is lobbying and negotiating with the government officials in bringing about the desired change, which I must say is one of the most difficult steps, because it's not easy to first get appointment from them, the government officials, and secondly, even if we get appointment, to convince them to take action on a particular issue, it's extremely difficult. And here is how we can use our negotiating skills. Okay, now the earliest example of advocacy in public health is the classic case of cholera in mid-19th century England. During the 1848 cholera epidemic, Sir John Snow mapped out the locations of cholera cases and demonstrated that the epidemic raging in London was not evenly distributed across the city. And he identified that one particular source of water, which was the hand pump in Broad Street, which in the Broad Street, wherein so the all the areas which was supplied by this hand pump was having cholera. So he kind of made a correlation that cholera is spread through water. Now I can say that this was a landmark in this finding in the field of public health, and after this cholera, after this finding, he removed the Broad Street, the handle of the Broad Street hand pump, and cholera cases started declining in the surrounding area. So after this, Snow, along with others, began to advocate the provision of clean water. So this is how the advocacy on clean water and sanitation was started as early as the 1840s in England. The impact of this campaign was such widespread that not only led to large-scale cleanliness in London, but it also led to large-scale cleanliness campaigns around in various European countries across, and these reforms are termed as the sanitary reforms. Now, political, economic, socio-cultural, behavioral, environmental and biological factors affect public health. We all know there was a module on the concepts of public health, and this was explained there. So health advocacy aims at making these conditions favorable for health. The scope of advocacy in healthcare would include campaigning for healthy lifestyle, identifying the risk factors leading to a particular disease through epidemiological study and spreading awareness on the same in the communities, and improving the quality of services provided by the healthcare providers. In the Indian context, there are many issues that can be taken up for advocacy in healthcare, and in fact they are being taken up by various organizations. First can be putting pressure on the government to regulate and monitor the quality of services provided by the private healthcare providers. Second, improving the quality of services provided by the government health service system. Then framing of health policies in accordance to the needs of the marginalized people residing in remote areas. This includes the BPL, SC, ST and other marginalized groups like women, children, disabled and the elderly. Now, effective implementation of the already framed policies programs like social audit and community-based monitoring prove useful in this area. Putting pressure on the government to increase the budgetary allocation on health. And this has been taken up by organizations like Jan Swasthya Abhiyan and Medico Friendly Circle. Working on issues of health denial, considering health as a fundamental right. Example, campaign on right to health by GSA and MFC. Advocacy for affordable medicine, use of generic drugs and amendment of Patents Act 1970. This was done by Affordable Medicines and Treatment Campaign launched in 2001 by NGOs, activists and civil society groups. So as we have seen on this slide, there are various avenues in which a social worker can work in terms of advocacy in health, right from improving the quality of services provided by the private sector as well as the government sector, or to formulating of policies as per the needs of the marginalized groups, to effective implementation of the policies. They can also work in terms of putting pressure on the government to improve the budgetary allocation, to fight for causes of health denial, because health is a right to health is a fundamental right, and also in putting pressure on the government to reduce the cost of drugs, make drugs more affordable, and use of more generic drugs should be promoted. So it's not that advocacy is not being done on these themes. The advocacy in all these themes are being actively done by the Jan Swasthya Abhiyan, a civil society group. the details of which I have kind of mentioned in the last bit of this module. Some of the other examples of advocacy in the field of health in India is the recent example of advocacy campaign on tobacco. The Health Ministry's persistent efforts led to the National Tobacco Control legislation. The advocacy efforts led to building and shaping the social and political climate against the tobacco in India. And for this, the Indian Health Ministry received the US Award for Health Promotion and Tobacco Control. Immediately after this, American Cancer Society declared the Health Ministry of India as a model to which other nations may aspire. But this is a good example, but when we see it against the Right to Health campaign, it is quite small. The Constitution of India doesn't guarantee, as we all know, the Constitution of India doesn't guarantee right to health as a fundamental right. It does guarantee right to life. But however, due to the efforts of the advocacy campaign by several civil society groups headed by Jan Swasthya Abhiyan and Medico-Friendly Circle, the Supreme Court in several cases has extended the right to life under Article 21 of the Constitution as right to health. So now the rest of the module is trying to focus on what right to health is and how one can seek redressal in case of violation of the right to health. Now, as we have mentioned, the Article 21 of the Constitution guarantees the right to life. Alright, so it says that it is the duty of the state to safeguard the right to life of every person, and this right to life has been extended as right to health because if you're not healthy, you won't be able to stay alive. Okay. It's not just this article, but there are other provisions also in the Indian Constitution which have talked about this. Let us see. Article 42 of the Constitution says that provision for just and humane condition of work and maternity relief should be there. The state shall make provision for securing just and humane conditions of work and for maternity relief. And Article 47 of the Constitution says that it is the duty of the state to raise the level of nutrition and the standard of living and to improve public health. The state shall regard the raising of the level of nutrition and the standard of living of its people and the improvement of public health as among its primary duties, and in particular the state shall endeavor to bring about prohibition of the consumption except for medical purposes of intoxicating drinks and of drugs which are injurious to health. So both of these are directly specifying the role of the state in terms of safeguarding health. Now, as I mentioned that in several cases the Supreme Court has extended the right to life as right to health and has made it as a fundamental right. Some of the examples I have described here. Recently, the Supreme Court of India had ruled that serving and retired government employees are entitled to free medical care, including treatment at any state-of-the-art medical institute. This case arose from the appeals of the Punjab government challenging the State High Court's directive to reimburse costs to its employees who had undergone angioplasty at the capital's All India Institute of Medical Science and the Escorts Healthcare Foundation. The judges explained that the scope of Article 21 of India's Constitution, right to life, and ruled that right to health is integral to right to life and dismissed the Punjab government's appeal. Now, in another case, an agricultural laborer who fell off a crowded train and sustained serious head injuries, he could not be admitted to a nearby government medical college hospital because of the shortage of beds and had to be admitted to a private hospital which charged fees for its services. In this case also the Supreme Court had ruled that under Article 21 of the Constitution, government hospitals cannot deny medical facilities to seriously ill patients on flimsy grounds such as non-availability of a bed, and any patient denied of such medical facility is entitled to compensation. So we see that Article 21 imposes an obligation on the state to safeguard the right to life of every person. Preservation of human life is thus of paramount importance. The government hospitals run by the state and the medical officers employed therein are duty bound to extend medical assistance for preserving human life. Failure on the part of a government hospital to provide timely medical treatment to a person in need of such treatment results in violation of his right to life guaranteed under Article 21. Therefore, the failure of a government-run health center to provide timely treatment is violative of a person's right to life. So, the Supreme Court ordered that primary healthcare centers should be equipped to deal with medical emergencies. The lack of financial resources cannot be a reason for the state to shy away from its constitutional obligation. Thereby, there is an implication that enforcing of the right to life is a duty of the state, and that this duty also covers providing the right to primary healthcare. So, we see that in spite of the fact that the right to health is not mentioned as a fundamental right in our constitution, it still due to the advocacy efforts of advocacy campaigns, it has been extended. The right to life mentioned in Article 21 has been interpreted as right to health by the Supreme Court of India in various occasions which I have described. So mainly in terms of emergency care and in terms of providing primary health care, a government health provider cannot deny any person from treatment as per the right to health. So it is now a settled law that right to health is integral to right to life. Government has a constitutional obligation to provide health facilities. Apart from recognizing the fundamental right to health as an integral part of right to life, the Supreme and High Courts rules that it is the obligation of the state to provide medical health services. Every doctor, whether at a government hospital or otherwise, has the professional obligation to extend his services with due expertise for protecting life. So, under this backdrop, I can say that denial of healthcare is against the Constitution and is a punishable under law. Hence, one can demand justice in case of denial of healthcare. However, hardly many people are aware of this, and there are cases of health denial happening day in and day out without being reported. So here the role of social worker becomes critical in helping people seek justice. Some of the avenues for redressal of cases of health denials have been mentioned in the rest of the module. First and foremost are the medical councils. Now, what are medical councils? These are statutory bodies that are created by an act of the Parliament legislature to monitor, govern the medical profession. The council has only ethical jurisdiction. It cannot give compensation to the complainant or punish the doctors. The only punishment that it gives is cancel the registration either temporarily or permanently of the doctor who is kind of involved in a health denial case. Now, what is the process of filing a complaint to the Medical Council of India? The complainant has to file the complaint with the registrar of the council and file a specific declaration as per the prescribed format. The council's executive committee holds the preliminary hearing to find out the authenticity of the complaint. At this meeting, only the complainant and the doctor against whom the complaint is filed are allowed to present their sides. Lawyers are not allowed to be present. If the executive committee finds some truth in the complaint, then the full council hears the case. Now, there are a lot of problems in this kind of redressal of health denial through medical council, because first and foremost, the council meets only twice in a year. Therefore, the complaints are not resolved very fast. The preliminary hearing is heavily weighed against the complainant, who is usually a non-medical person. So, Medical Council of India, after all, it's a body of doctors. So, obviously, they are kind of biased towards the doctors, and many times they are not, they are favoring the doctors. So, therefore, councils have been very inefficient in resolving the complaints of the consumers of healthcare. So, they are merely by namesake, I can say. Now, the next avenue of redressal can be through consumer forums. the consumer forums operate under the Consumer Protection Act of 1986. This act of Parliament enacted in 1986 is made to protect interests of consumers in India. It makes provisions for the establishment of consumer councils and other authorities for the settlement of consumer disputes and for matters connected therewith. Now you must be wondering that what does healthcare have to do with consumer forums? But healthcare is again a consumer good wherein people are paying the medical providers for healthcare, so it can be healthcare can be considered as a consumer good. So it came up through a recent ruling in Kerala that brought which said that medical services in the private sector should be under the ambit of the Consumer Protection Act. There was a lot of opposition on this by the medical fraternity, who feels the doctor-patient relationship is personal and not that of a buyer and seller. But the Consumer Protection Act says that in a healthcare, medical services which are technical in nature are bought for a fee. So we can say that healthcare provided by the private sector can be considered as a consumer good, and hence any case of health denial by the private sector can directly be reported to the consumer forums. Earlier, patients would go to the Medical Council of India, a body comprising of doctors which I just described, where there was a tendency to protect the doctors or court, but through CPA, justice is quick and free of cost. Now, and compensation is given to the patients, like monetary limits of compensation. If it's reported at the district level, the consumer for compensation of up to 20 lakhs is given. In state level, 20 lakhs to 1 crore, and if the compensation is above 1 crore, the national level consumer court takes it up. Now, what is the process? The complaint should be written on a simple paper giving all the details and the compensation demanded. All the complaints against the doctor and the hospitals should have an expert certificate opinion from the doctors of concerned specialty, stating that the complaint is true and needs further investigation. In the absence of such certificate, the complaints against the doctors' hospitals are usually not admitted. Therefore, the consumers must have all relevant medical records. The expert opinion can be obtained with the help of a consumer organization in the area. A-Cash, one organization is there, along with Forum for Medical Ethics, has formed an expert panel to help the consumers. It must also be remembered that a fine of rupees 10,000 can be imposed on the complainant under the Consumer Protection Act if the complaint is found to be false. So though the Consumer Protection Act has time limit of 120 days for disposal of cases, in reality the case takes anywhere between 2 to 3 years for disposal. Some of the other avenues can be civil courts and criminal courts, but the civil courts, the redressal of the patient's complaint through this medium is lengthy, time consuming and many times counterproductive. There is a tremendous backlog of cases and the cases take anywhere between 10 to 15 years to complete. In the criminal courts, the redressal of the complaints under criminal law is not very common and recourse to this method should be taken only in exceptional cases. Now, coming to the last bit of this module, which is role of civil society in health advocacy. As I mentioned right at the beginning, that there is an immense role that the civil society can play in the field of health, and I mentioned various areas in which civil society can play a role. And I also said that these are being taken up by a very famous organization, which is Jan Swasthya Abhiyan. So in this part I'm kind of describing what they are doing in details. It is what is JSA? Basically JSA or Jan Swasthya Abhiyan is a coalition of over 20 networks and 1,000 organizations as well as large number of individuals that endorse the Indian People's Health Charter, a consensus document that arose out of Jan Swasthya Sabha held in December 2000 to discuss the Health for All challenge. The Jan Swasthya Abhiyan is the Indian circle of the People's Health Movement, a worldwide movement to establish health and equitable development through comprehensive primary health care. The National Health Assembly is a wing under JSA which is working to oppose the weakening of public health systems, to make health systems accountable and effective, to counter commercialization of healthcare, and to ensure access to healthcare for all within a broader right to health framework. Although not always adopting an explicit right to health terminology, a wide range of activities have been carried out by JSA in various states towards demanding the right to healthcare as well as ensuring the right to various determinants of health. As I mentioned earlier, that the Jan Swasthya Abhiyan has played a major role in demanding for the right to health. In fact, it is because of their efforts that the Supreme Court has extended the right to life, Article 21, to right to health as well. So JSA had organized a national right to healthcare campaign in 2003-4, which included organizations of national public consultation, documentation of cases of denial of healthcare, surveys of rural public health facilities, local Jan Sunwais, in some states, regional public hearings in all regions of the country, followed by a national public hearing on health rights. And it is because of these endeavors that the right to health came in. But now they are demanding that there should be a uniform law which should clearly mention that the right to life is extended to right to health, and they were expecting that the present health policy would talk something on these lines, but it has not happened till now. So the JSA activists are still advocating for it. The JSA state units also have played an active role in nationwide right to food campaign since 2002, considering nutrition to be very important in health. They have also, JSA activists have also worked closely with NRHM, trying to shape NRHM in a pro-people manner while trying to assess to what extent the proposed improvements were actually being implemented in the form of conducting a People's Rural Health Watch in 7 states during. So they kind of did a evaluation of the National Rural Health Mission, trying to see as to how far they are kind of committing to their objectives that they specified in terms of improving the rural health care. And one of the very good achievements of JSA is that because of their endeavors, the community-based monitoring has been introduced as a part of National Rural Health Mission, wherein the people from within the community along with NGOs are monitoring the working of the public health systems on a day-to-day basis, and they're kind of lodging complaints through Janus 15, and actions are being taken in case of any violation of the duties of the concerned officials. So here I've mentioned some of the examples of activities that have been done by JSA in various states. It includes the ongoing Right to Primary Health campaign in Karnataka, Right to Essential Medicines and Free Treatment campaign in Rajasthan, campaigning for establishing people's right in the private medical sector, particularly patients' right, organized monitoring and demanding of people's health rights from the rural public health system through a system of community-based monitoring. CBM activities are also initiated in some other states like Madhya Pradesh, Orissa. So through the example of Jan Swasthya Abhiyan, we have kind of looked that they are addressing each and every aspect of advocacy that can be taken up in the health sector. So it's this kind of a role model for us to understand health advocacy, especially in the Indian context. And hence, I can say that advocacy in public health is the need of the hour, and social workers need to play a more active role in this. So to sum up, we have kind of understood what advocacy is, what are the various strategies, what is the process, what is advocacy in health is, what is the scope of advocacy in health in India, and then finally we have taken up a case example of Right to Health campaign by Jan Swasthya Abhiyan. We have tried to understand how the right to life has been extended as right to health by the Constitution of India, and through various cases, and then finally we have also looked at as to how a patient who has been denied of his health rights can seek justice through consumer courts or through Medical Council of India. And finally, we have tried to understood the work of Jan Swasthya Abhiyan in details, which is a model in terms of health advocacy campaign in India. Thank you so much.